Hello everyone. So this is the session of lymphoid organ series. This is the second part, targeting for the NEET PG 2022. So I will describe in brief the lymphoid organs and then it will be followed by the MCQs related to the topic. So this is how we will compile it. So let's start with the topic, and before starting the topic I would like to tell you about myself. Dr. Monalisa, MD Anatomy from Armed Force Medical College, Pune, and I am here to describe the lymphoid organ histology part and the MCQs related to the topic so that you can know which type of questions and MCQs come from this topic in the entrance exam of NEET PG. So yeah. So before starting the exact session, let me tell you about the special class. When I am talking about the special class features, it's an interactive session where the learners and the educators interact. Okay, the polls are conducted among the learners, and they can know their weak area and they can pay more attention or give more revision to that area. So that will also give you a better rank in the entrance exam. Never ever miss a session. What is this meaning? This means that once you start seeing the session of an educator on the special or free platform of Unacademy and you start following that educator on the Unacademy app, you will get notification regarding the session taken by the educator, and you are not going to miss any of the important sessions taken by the educator. Lecture notes, what does that mean? So once the session is finished, you can also download the PDF notes of that session and anytime, anywhere read from the top educators of Unacademy platform. My dear aspirants, let me talk about the plus subscription. What is this plus subscription? All 19 subject which is targeted for your entrance exam so that you can acquire a better rank in the competitive exam. So in that categorization, what happens? You can assess both the live recorded version of all 19 subject taken by the top educators of Unacademy platform, learn from top educators in the medical stream, and compete in live tests and quizzes, study on the device of your choice, and assess more than 25,000 MCQs which is made by the top educators of Unacademy platform who have got an experience of more than 8 or 10 years, and also a detailed explanation is provided to you. So a detailed explanation is provided to you for each and every MCQs of all 19 subject clinical MCQs based on latest pattern, which will help you to target a better rank in the competitive exam. Now, my dear aspirants, soon what is coming up in the Unacademy Plus subscription is that if you are going to take the subscription of 1 or more year, you are getting a printed notes of Plus subscription. Now, let's talk about the iconic subscription. When I am talking about the iconic subscription, the benefit is of two best platforms for the competitive exams, which is one is the Plus course, that is the live sessions taken by the Unacademy educators. The other is the Prep Ladder series. So in this Prep Ladder, you get the clinical integrated essentials video recorded lectures from the Dream Team, QBank, 3 tags, rapid revision, treasure, dream notes of 2021. So all these can be assessed by you, and this will be highly beneficial for you. So my dear aspirants, I would also like to tell you that boost your medical preparation by taking the subscription. So if you are going to take the subscription of 24 months, that is 2 years, you are getting 4 months of subscription absolutely free. If you are going to take the subscription of 1 year, you are getting 2 months of subscription absolutely free. Okay, and if you are going to take the subscription of 6 months, you are getting 1 month of subscription absolutely free. So all these benefits can be acquired by you if you are going to take the subscription of Unacademy. You can use my code, that is ANAT10, and if you are using my code, you can get an additional benefit of 10% discount. So just go for it and grab this opportunity. I would also like to tell you about NEET PG Combat. What is NEET PG Combat? So NEET PG Combat has already been taken study, and I think most of you must have targeted a good rank, and exciting prizes of emergence vouchers of 20,000 and 1 crore scholarship is waiting for you. So this is done. So let's start with the histology of lymphoid organ. So when I am talking about the histology of lymphoid organ, in this category I am going to cover up the following lymphoid structures. The lymphoid structures which I am going to cover up is the 4. So firstly we will talk about the thymus gland, lymph node, spleen and tonsil. So these are the 4 lymphoid organs or structures which is highly important for your MCQ session. It is highly important for your MCQ session for targeting for your competitive exam. So what is very much important is that we are going to target this. We are going to cover up this topic. So let's start with this. Let's start with the first structure, that is the thymus gland. So everyone, can you appreciate this green color bilobed structure, okay, which is shown in this diagram? This structure I am talking about. Yeah, yeah, this structure. Okay, okay, so this is bilobe structure and this is thymus gland. So thymus gland is a bilobe structure which is residing where? It is residing in superior mediastinum and that of anterior mediastinum. Lower part is lying in the anterior mediastinum, upper part of thymus gland is lying in superior mediastinum. This is all about the location of the thymus gland, bilobe structure, dual origin. Now, let's talk about the histology. So, we are concerned about the histology. So, I will talk about the histological aspect only. So, when I am talking about the thymus gland histology, it is made of cortex and medulla. Okay. So, the major structure in the thymus gland is cortex and medulla. And what happens? There is a covering that is called as fibrous capsule. So, outermost covering is called as fibrous capsule. From here, septas are given inside, incomplete septas are there, incomplete septas are there. So, this incomplete septa will divide the interior of thymus gland into lobes and lobules, but inside there will be a darker stained cortex and there will be a medulla. Okay. So, there resides a cortex and the medulla. Cortex will be darker stained, dark stained, cortex will be dark stained, medulla will be light stained. Why is this so? So, medulla is light stained because it is containing immature T lymphocyte. It is containing immature T lymphocytes. So, my dear aspirants, it is also important that the thymus gland is only containing T lymphocytes, and when we are talking about the medulla, it is containing immature T lymphocyte, and that is containing, what does that immature T lymphocyte contains? Hazel corpuscles, that contains Hazel corpuscles. Okay, that contains Hazel corpuscles, which is a characteristic feature for the identification of thymus gland. So, Hazel corpuscles is a characteristic feature for identification of thymus gland, and its inside is immature. Now, let's talk about this. So, I want to show you the thymus gland, a bilobed structure, thymus gland which is a bilobed structure. It's a primary lymphoid organ. Okay, T lymphocytes are generated. So, if you will see, if I slightly highlight this diagram, can you see I am enlarging this diagram? This part which you are seeing is the medulla part. This is the medulla part which is lighter stain, and on outer aspect what you can see, this is the darker stain structure. Okay, this is the darker stain structure. So, here this part which I am highlighting with the light green, this is the cortex area, which you can see here that it is quite what you can see that it is quite darker stain because it contains mature T lymphocyte. Okay, so this is the cortex area which is darker stain containing mature T lymphocytes, and the lighter stained is the medulla. This is the medulla which is lighter stained. This is lighter stained because immature T lymphocytes are right. Now, my dear aspirants, other important point for the identification is that, a very important point for identification is that, what you can appreciate that there is Hazel corpuscles residing inside the medulla part. There is Hazel corpuscles residing. So, see here, if I enlarge again, so I am just enlarging this so that you can just focus on this Hazel corpuscles. So, yes, is it, see here. So, now I would like to show you the Hazel corpuscles. So, again this is one lobes and lobules, this is the medulla part. In the medulla part, what you can see, this is one Hazel corpus, this is one Hazel corpus, this is one Hazel corpus, this is one Hazel corpus. So, you can see inside so many Hazel corpus. Actually, the number of Hazel corpuses increases. The number of Hazel corpuses increases with age, and what is it? It is a laminated body. It's an laminated pinkish astophilic body which resides. The number increases with the elderly thymus gland. Exact function is still not known, but it is supplementing the function of thymus gland, it is thought. So, research is going on, and this is one of the characteristic feature. The presence of Hazel corpuscles in the medulla part is the characteristic feature for identification. The presence of Hazel corpuscles in the medulla part of the thymus gland is the characteristic feature for identification. The other important point is that actually we know that all the lymphoid organ is having a supporting network, and that supporting framework or network is provided by reticular fibers. In case of thymus gland, the supporting framework or network is provided by epithelio-reticular cells. So this is another important point which must be known to you, that thymus gland is not containing reticular fibers, but it is containing epithelio-reticular cells which is providing supporting network or framework of thymus gland. So write down this important information. Thymus gland is actually one of the lymphoid structure. Thymus gland is one of the lymphoid structure which is containing, not contains reticular fibers. It is not containing reticular fibers as supporting network, or you can say framework. The supporting framework of thymus gland is the supporting framework of thymus gland. The supporting this is about thymus. The supporting framework of thymus gland is formed by which structure forms the supporting framework? Epithelio-reticular cells. Epithelio-reticular cells. Other important function of epithelio-reticular cells is that it also leads to the formation of blood thymic barrier. What is the importance of blood thymic barrier? What happens? It will preserve, or it will you can say it will not let the interaction of the antibodies, which antigen and antibodies, so reaction of the blood antigens. So actually it forms a barrier. Epithelio-reticular cells along with the capillaries, endothelium and basement membrane, it forms a barrier where the immature T lymphocyte which is growing inside the medulla part of thymus gland is not interacting with the blood antigen of the blood which is surrounding it. So this is the function and the role of the thymus gland, which is very important for the immature T lymphocytes to grow properly. So my dear aspirants, before that one more histological slide. This is again a slide of thymus gland. And in this slide of thymus gland, what I want you to show is the reticular cells and the cells of the thymus gland, that is thymocytes. So you can see here, these are thymocytes which is shown. These are the thymocytes and these are the reticular cells. So in this diagram we can clearly see the reticular cells and that of the thymocytes. So we can see the reticular cells and thymocytes very nicely. And now what I want you to show the layers of blood thymic barrier. So blood thymus barrier. The function of blood thymus barrier is that it prevents the contact between high concentration of antigen circulating in the blood. So what is the function of blood thymic barrier? It is preventing the interaction of the high concentration of the antigens which is flowing in the blood with the developing immature lymphocytes in the thymic cortex. So this is the importance. Now next important point is which are the layers which is forming the blood thymic barrier. The layers layers you can say, or you can say the components which is forming the blood thymic barrier is endothelium, basement membrane of endothelial cells, thin perivascular connective tissue space which is containing the pericytes, macrophages and the fibroblast. Also the basement membrane of epithelio-reticular cells and the epithelio-reticular cells. So my dear aspirants, it's very clear that these are the 5 structures which is forming the layers or the components of epithelio-reticular barrier formation, blood thymic barrier, BTB. In short you can write BTB, blood thymic barrier. Endothelium, basement membrane of endothelial cells, perivascular, the surrounding connective tissues, macrophages, fibroblasts, basement membrane of epithelio-reticular cells and the epithelio-reticular cells. So most important content for the blood thymic barrier is epithelio-reticular reticular cells. The same thing is shown here, my dear aspirants. You can concentrate here. This is the blood thymus barrier. You can see epithelio-reticular cells, perivascular connective tissue and the capillary wall. So from here to here, this is the blood thymic barrier. Now, before proceeding to the next slide, few of the histological slides. So this is the histological slide of thymus gland, and a very clear picture of the Hazel corpuscles has been shown. So this is one Hazel corpus, this is another Hazel corpus. So whenever you see a slide, how you are going to identify the slide of thymus gland. So very nicely you can identify the slide of thymus gland. So the first thing which is seen here, what is this? This is the fibrous capsule FC. This is the cortex area, the darker stained. This is the cortex area. This is the medulla area. So this is whole of the medulla. This is the whole of the cortex area which you are seeing. This is the cortex, this is the medulla, and inside the medulla the structures which is visible clearly is the Hazel corpuscles. So very nicely you can appreciate the Hazel corpuscles residing inside. So I would like to show you an enlarged view where epithelio-reticular cells, laminated bodies are concentrically arranged in a wall, and this circular structure, the highlighted structure which you are seeing, this is the Hazel corpuscles. It will appear pinkish in color, and it is also in elderly case, it also contains some concentration of calcification is seen inside. Okay, so this is the whole of Hazel, HC for Hazel corpuscles. What is it? This is Hazel corpuscles identifying features for the thymus gland. Okay. Now another diagram where the thymus gland, young thymus gland has been shown, where the entire of the slide is shown. So it is a low power view. This is showing you the thymus gland in low power view. Low power, you can say 10x power, and here you can see again the lighter stained part is the medulla, and yes, please don't confuse. Can you see here this small pinkish structure? Okay, so yes, I will just this is one Hazel corpuscles, this is another Hazel corpuscles. So few Hazel corpuscles has been shown. The cortex area, this is the cortex area which is seen. Okay, this is the medulla area containing Hazel corpuscles. The fibrous capsule is very evident. The fibrous capsule, this is the whole of the fibrous capsule. What I told you, fibrous capsules say incomplete septas are going inside, and these are dividing the whole of the thymus gland into lobes and lobules, as you can say, and the medulla is containing Hazel corpuscles, the characteristic feature for the identification of thymus gland. So is it okay? So we have got all the identifying features here. Now what is required is to move on to the next slide, that is the lymph node. So let's talk about the lymph node. So lymph node, the basic histological feature will be same, similar only. The thing is that the outermost layer is the fibrous capsule, then it is again having the division into cortex and that of the medulla. So it will again have the cortex and the medulla. As you can see, in the medulla there is medullary sinuses. Okay, so fibrous capsule से क्या arise करता है? Septus trabeculus, which is dividing the interior of the lymph node into lobes and lobules. Okay, the hilum area where the efferent vessels has been shown, afferent vessels are also been shown, and the reticular fibers are the important supporting network. So lymph node histology, outermost layer is outermost covering of lymph node is of fibrous capsule. Outermost covering is of fibrous capsule. It is having cortex and medulla. So the cortex part is darker stained. Actually it is composed of lymphoid nodules, lymphatic aggregation. It contains lymphatic aggregation. Medulla is containing medullary cords and sinuses. It contains medullary cords and that of sinuses. So medullary cords and sinuses is present in the medulla. Outermost covering is fibrous capsule. From the fibrous capsule, trabecules are given inside, and these trabecules will divide the interior of the lymph node into the lobes and lobules. Okay, and here the supporting network. Okay, if I talk about the supporting network of framework, the supporting framework or network is supported by reticular fibers. Actually, in all the cases of lymphoid structures, that is in case of spleen, in case of lymph node, in case of tonsil, the supporting network of framework is formed by reticular fibers. Only in case of thymus gland it is formed by epithelio-reticular cells. Okay, So now I would like to show you a diagram for it. So this is a beautiful diagram of the lymph node. It's a very nice and a clear histological picture which is shown to you is of the lymph node, where you can clearly see the cortex area, you can see the inner medulla area, and you can appreciate. Actually, if you will, let me slightly highlight this diagram. Okay, so this is slightly a high power view so that we can clearly identify the structures. So see here, the outermost layer. So yeah, this is the outermost covering or the layer which is formed, and as you can see, the outermost covering is the capsule. One more important point is much important, and it is again the characteristic feature for identification for the slide of lymph node, is that just below the capsule there is a space, and that space is called as subcapsular sinus. So let me just show you this space. Can you appreciate this space which you are seeing is the subcapsular sinus. So this is subcapsular sinus. So there is a capsule, below it is the subcapsular sinuses, then trabecules are given inside, and it will divide the whole of the interior of the lymph node into cortex and the medulla, lobes and lobules. Now here what is highlighted in this diagram and what is shown you here in the diagram is the lymphatic nodule or follicle. Aggregation of the lymphatic nodule. Actually, the zone of lymph node aggregation is divided into 3 zones. The innermost zone is called as the germinal center, then is the mantle zone, and then is the lymphatic follicle. Okay, so this germinal center consists of immature lymphocytes which is growing. The mantle is containing the other lymphocyte which is surrounding it, and the most mature lymphocyte is lying on the periphery. So the most mature or the aggregation of lymphocyte which is lying on the outer aspect is called as the periphery. So this is how it is divided. And whenever you see a lymphatic aggregation which is located below the space of subcapsular sinus having a 3 zones, you can see a darker stain. Actually, it is quite easily seen the lighter center. Here also you can see this is the lighter center, this is the lighter center which is called as the germinal center, containing less aggregation of lymphatic lymphocytes, which is the B lymphocytes, and developing immature. So it is a lighter stain as compared to the matured, aggregated, dense concentration of the lymphocytes in the periphery. So yes, now I would like to show you another diagram of the lymph node. This is again a histological slide. Actually, this is taken from D. Furey's histology book, so which is very nicely describing the whole features of the lymph node. So the same thing here lies. Let me give you the correlation of all the layers. So this is the fibrous capsule which I told you. This is the outermost fibrous capsule. Now my dear aspirants, just below it, okay, let me show you. I am using this green color. Can you see a lighter stained area or a space is lying? So this space is called as subcapsular sinus. What is it called as? This space is called as subcapsular sinus. This space is called as subcapsular sinus. So let me highlight it. Okay, so this space is called as subcapsular sinus. Now here is the lymphatic aggregation, here is the lymphatic aggregation, the lighter stain. So you can see the lighter stain is the germinal center, and the connective tissue trabecules are going inside. So what you can appreciate, these are all trabecules which is dividing the interior of the lymph node into lobes and lobules, and this is the medulla part, this is the paracortex. So just below the cortex area is called as paracortical area, deeper cortex is called as paracortical area, and then we have got on more deeper aspect medulla, which is containing medullary cords and medullary sinuses. So it contains capillaries which is discontinuous, and for more of diffusion to occur, and the reticular fibers are also residing in between, providing supporting network. So actually in H&E stain, reticular fibers are not seen, but you have to know that the connective tissue framework or the supporting framework is formed by the reticular fibers. So yes, now let's move on to the other histological slide so that you can appreciate it. So this is a slide of lymph node. Very nicely again you can see the fibrous capsule, and you can see this space is the subcapsular sinus. This space which you are seeing is the subcapsular sinus, this space, subcapsular sinus, trabecules, and this is the lymphatic aggregation. lymphatic aggregation. Now let me show you another diagram. This is these are the real histological slide which has been marked. This is again a histological slide of lymph node. So see here, many, so this is germinal center, this is whole lymph node, okay, this is also lymph node, this is also lymph node. So yes, now you can appreciate this is lighter stain, this is the center is lighter stain which is germinal center, this is also germinal center. Here you can see trabeculae are dividing it into incomplete septas. So, and there will be medullary cords, medullary sinuses, and this outermost covering is of fibrous capsule. Just below the fibrous capsule there is a space. This space which you are seeing is the subcapsular sinus. This space is subcapsular sinus. So, this is how you can appreciate the slide of the lymph node. So, let me just rub it. All the features are quite evident here. So, this is how the exact slide of lymph node looks in the low power view. So, this is the lymph node low power view. Low power view, that is 10x power view of the lymph node. Okay, my dear aspirants, so after that let us move on to the next, that is the histology of the spleen. So, let us focus on to the structure of the spleen and the histology of the spleen. Spleen is a very important slide. You can't skip this slide. You can't skip this slide because always in the repetitively what I have observed in the last 5-6 years, that the spleen histological features is definitely one of the question which has been asked in the histology. So, what is important that we will concentrate on the spleen histology too. Now, it is also a lymphoid organ. So, yes, it is having reticular fibers as the supporting network, but the major area, if you will see interior of the lymph of the spleen, it is made of white pulp and the red pulp. So, it is important that you should have an idea what does this white pulp contains and what does this red pulp contains. Okay. So, outermost is similar, that is the fibrous capsule, trabeculae are given inside. So, the interior of the spleen is divided into lobes and lobules, and inside you will have a white pulp and red pulp. Actually, when I am talking about white pulp, when you freshly cut the spleen, the white pulp means lymphatic aggregation, red pulp will appear reddish when it is pinkish reddish when it is freshly cut, and it contains splenic venous sinusites. What is venous sinusites? What do you mean by the word sinusites? Now, a capillary which is having fenestration, discontinuous endothelium and basement membrane which is highly permeable is called as sinusites. So, splenic sinusites are residing in the red pulp along with the plasma cells, macrophages and all, and this constitute the red pulp part of the spleen, and the white pulp is having the lymphatic aggregation. So, I would like to write firstly few of the points of the histology, and then I will move up with the histological slide. So, write down in detail spleen histology. Outermost covering is made of fibrous capsule. Outermost covering is made of fibrous capsule. From the fibrous capsule, trabeculae or septas are given inside, which will divide the whole of the spleen into lobes and lobules. Connective tissue framework. Connective tissue framework or supporting network, or you can say supporting framework, is formed by reticular fibers. It is given by which fibers? Reticular fibers. Now, basically let us move further. The other important point of the histology is that it contains white pulp. The spleen is made of white pulp and that of red pulp. Now, what does this white pulp contains? White pulp contains lymphatic aggregation. Lymphatic aggregation. This lymphatic aggregation will contain eccentric location of central artery. Eccentric location of central artery. My dear aspirants, I would like to show you that image and you will understand, don't worry. Red pulp is made of splenic sinusites. Okay, my dear aspirants, let me show you this diagram so that your concepts will be clear. So, let me highlight this diagram. Yeah. So, this is a slide of spleen. This is a slide of spleen. Yeah. So, this is a slide of spleen. Spleen histology. Now, my dear aspirants, what you can see, the outermost covering is still, you can see this is the fibrous capsules. Trabecules or septae are given inside. Through this trabecules and septae, what traverses inside is the central artery. What is traversing inside is the central artery. Now, my dear aspirants, when the central artery is residing inside, what happens? It is having a surrounding of lymphatic aggregation. So, central artery will be surrounded by lymphatic aggregation. So, this central artery in the initial part was central in the location, because when it was entering, trabecular artery will traverse along the trabeculae. Then it will change its name, central artery. It gets surrounded by the lymphatic aggregations, but soon it is pushed towards the periphery. So, see here, my dear aspirants, this is the central artery which you are seeing. Okay, this is the central artery, and you can see it is pushed towards the periphery. It is not lying exactly in the center, and there is a lighter stain germinal center, and this is a lymphatic nodule white pulp. So, you can see here so many lymphatic nodules are there. This is one, this is one, this is one, and in all the lymphatic nodule, the basic point to be appreciated is that eccentric location is the location of. So, what you can see, this is the central artery, this is the central artery, this is the central artery. So, what you can see, the central artery is exactly eccentric in location. Why eccentric in location, my dear aspirants? Because the lymphatic aggregation has pushed the central artery to the peripheral position, and it is now eccentric in position. The center is containing the germinal center, and this one is the lymphatic aggregation. This is this is all forming what? This is all forming the white pulp. So, we have done with this. Now, let me again rub this hole. Now, I would like to tell you the rest part which you are seeing. So, other than that, what you are seeing here is the location or is the red pulp. So, these are all red pulp. So, this is all red pulp. Okay. Now, another important point is that exactly in the vicinity of the central artery, the lymphocyte which is lying is called as pulse. Okay, what is pulse? Periarterial lymphatic sheath, and this periarterial lymphatic sheath which is covering the vicinity of the central artery is containing only T lymphocytes. So, these are few points which has to be noted down. So, let me show you one more slide. Here you can see this is lymphatic nodule, lighter stain germinal center. This is the central artery. Location is eccentric. Central artery location is eccentric in position. It is eccentric in position. There is splenic cords, venous sinuses, and also in the trabecular artery is traversing. So, actually this is the splenic histological slide, and here you can see this blackish structure which is shown is reticular fiber. So, this is reticular fibers which has been visualized, which is forming supporting network for the spleen. Now, write on this, the trabecular arteries traverses via trabeculae, enter the white pulp to form central artery. So, when it enters the white pulp, it is called as central artery. Soon the central artery is surrounded by, lymphatic aggregation, and will push the central artery, and this lymphatic aggregation pushes the central artery towards periphery. So, it will push the central artery towards the periphery, and now the central artery is eccentric in position. So, now the central artery will become eccentric in position, will become eccentric in position. So now the central artery will become eccentric in position, and the lymphatic aggregation which is lying in the vicinity of the central artery is called as periarterial lymphatic sheath. So this is another important point. So write down the lymphatic aggregation, surrounding the central artery, the lymphatic aggregation surrounding the central artery, the lymphatic aggregation which is surrounding the central artery is termed as PALS, pulse. So what is pulse? Periarterial lymphatic sheath. Periarterial lymphatic sheath. My dear aspirant, another important point is that periarterial lymphatic sheath. When I am talking about periarterial lymphatic sheath, the other important point which has been asked to you, that what does this periarterial lymphatic sheath contain? So this periarterial lymphatic sheath contains only T lymphocytes. It contains only T lymphocytes. Okay, so done with this. Now my dear aspirants, let me show you the histological slides. So other important, and what does the red pulp contain? So we already know that the red pulp will contain medullary, the red pulp will contain splenic sinusoids. So what is splenic sinusoids, my dear aspirants? It is having discontinuous endothelium. So splenic sinusoids is exactly a capillaries, and these capillaries are highly fenestrated. It will contain discontinuous endothelium plus the basement membrane. Okay, so actually the term sinusoids means highly permeable capillary. So when only fenestrations or only discontinuous endothelium is lying, then we use the term fenestrated capillary. But the discontinuity is not only in the, or gap or the pores are not only in the endothelium but also on the basement membrane on which it is resting, that is called as splenic sinusoid. So this is highly permeable, and this splenic sinusoids is spindle shape and it is surrounded by reticular fibers, and so that whole structure is called as stave cell. So I will come to that, don't worry. So now again, see, this is the histology part of the splenic histological slide. So C for fibrous capsule. What do you mean by C? This is the part of fibrous capsule. Okay, this is one lymphatic aggregation, this is another lymphatic aggregation, and you can see here the surrounding structure in the vicinity is called as pulse. And this is what? What is this? This is central artery. This is what? This is central artery which is eccentric in position. This is what? This is red pulp. So red pulp, white pulp. This is how you are going to identify the histology of the spleen. But not only that, you will also find eccentric location of central artery in the lymphatic aggregation. Now what a beautiful diagram. This is again a diagram of low power view of the spleen. So let me slightly highlight it. Okay, so yes, you can see here outermost covering is of fibrous capsules. Trabeculae are given from inside. Red pulp, very nicely, and this is one lymphatic aggregation. This is also lymphatic aggregation. This is also These are what? These are all white pulp. These are all white pulp. Now here the important feature to be noted is central artery, central artery, central artery, central artery. The location of central artery is eccentric, and the rest whole part is the red pulp. This is the exactly how the slide of spleen looks under the microscope in the low power view. So again, so I would like to show you more histological slides so that you are not getting confused if this exactly slide is asked in the examination. So yes, here also you can see the white pulp, lymphatic nodules you can clearly see. You can see the red pulp. Again, this becomes the slide of spleen. Periarterial lymphatic sheath is also shown, periarterial lymphatic sheath which is surrounding the vicinity of central artery. Very nicely you can appreciate. Now one more diagram here, again the fibrous capsule, a beautiful diagram showing the fibrous capsule, very Nicely the fibrous capsule has been visualized. Okay, red pulp and the white pulp, red pulp, red pulp. Okay, also you can see the lymphatic aggregations, lymphatic aggregation, lymphatic aggregation, lymphatic aggregation, and what you can see, this is the white pulp, this is the red pulp, this is the fibrous capsule, and you can see the central artery, central artery, central artery. Now, this is what I want. Actually, this feature which you are seeing, why I have included this diagram or this slide. Actually, in this slide, you can see the stave cells. Okay, stave cells. So, what is the stave cells, my dear aspirant? So, stave cells is the characteristic feature which is seen in the red pulp. It is seen in the red pulp of the spleen. So, my dear aspirants, this spindle shaped structure which you are visualizing, this spindle shaped structure. Okay, so this spindle shaped structure which you are visualizing is sinusoids. What is this? These are sinusoids. So, we have already talked that what is sinusoids is discontinuous capillaries, and here what happens, this is residing in the red pulp. This sinusoid is covered by reticular fiber. So, we will focus. So, what you can see, let me use another color. So, you can see it is surrounded by reticular fibers, and actually this spindle shaped structure which is seen is the splenic venous sinusoids surrounded by reticular fibers, also containing few plasma cells and or macrophages which will phagocytize the old and worn out RBCs. So, this whole structure is called as stave cells, and as you can see, the shape is barrel shaped. This is barrel shaped. What is the shape? The shape is barrel shaped. So, spindle shaped structure and stave cells is only present in spleen, and it is a characteristic feature of the red pulp of the spleen. Now, why I have discussed that, because I want you to give the concept of two types of splenic circulation which is residing. That two type of splenic circulation is called as open circulation theory and closed circulation theory. Okay, so actually, so we will come to this. Firstly, you just know the definition, and then again I will move and show you the diagram. The concept of the closed circulation theory. Okay, so the concept of closed circulation theory, what is that? The blood passes directly from the arterial capillaries into the splenic venocytes of the red pulp. From here, the blood will enter the red pulp vein, which will join together and enter the trabeculae as a trabecular vein. So, what is closed circulation theory? That means the communication or transfer of arterial capillaries blood into the splenic venous sinusoids is occurring directly. The blood will enter directly, and this is called as the closed circulation theory of the spleen. When I am talking about the open circulation theory of the spleen, the blood passes from the arterial capillaries of penicilli, and then it will go into cords of Billroth. My dear aspirants, what is cords of Billroth? In case of spleen, red pulp, there is splenic venous sinusoids, there is macrophages, there is plasma cells, reticular fibers, all will phagocytize the old worn out RBC. So, there is a space, splenic cords of Billroth is a space lying in close vicinity of the splenic venous sinusoids. There the blood resides, and in this process what happens, non-flexible old worn out RBCs will be retained in the cords, of Billroth, and will be engulfed by macrophages. That means directly the transfers or communication of the splenic venocytes blood and the capillaries doesn't happen, but there is a you can say the blood will reside for a few times in the cords of Billroth, where old and worn out RBCs will be engulfed by macrophages. So, this is called as open circulation theory. Next important point is to show you the diagram so that you can appreciate this. Okay. So, see here, trabecular arteries are residing, then going inside, forming central artery surrounded by periarterial lymphatic sheath, and thereafter in closed circulation directly the blood is communicating here. As you can see here, it will directly, so this splenic venocytes will directly be in communication with splenic the capillary blood will communicate with the arterial blood, will communicate with the splenic venous sinusoids. But in case of open circulation, the blood will reside in the space, and this space is called a splenic cord of Billroth. So, it will reside in Billroth space where the old worn out RBCs is engulfed, and this is called as the open circulation theory of the spleen. So yes, done with this, let's move on to the next, that is palatine tonsil. So this is the last lymphoid organ which histology will be discussed, and it is very easy to understand the histology of palatine tonsil. Palatine tonsils are is almond shaped structures which is located in the tonsillar fossa. Now next point which comes in your mind, that tonsillar fossa is the space which is residing in the lateral oral cavity, and where it is exactly reside. It resides in the tonsillar fossa, which is having palatoglossal arch anteriorly and palatopharyngeal arch posteriorly. Actually that space is bounded by anterior pillar and posterior pillar. So what is the structure which is forming anterior pillar? Palatoglossal arch containing palatoglossus muscle. Posterior pillar is containing palatopharyngeal arch or palatopharyngeal muscle. So yes, that is the thing. This is whole of the gross anatomy. So I am not going into details of gross anatomy. The target for today's session is to discuss the histology part, microscopic feature. So we will concentrate on that. Palatine tonsil, you can see it is residing here in the tonsillar fossa, and this is the posterior part of the tongue. Actually in the posterior part of the tongue, what you see in the posterior part of the tongue, you can clearly see that there is aggregation of lymphatics. So lymphatic aggregation is there. In the posterior part of the tongue, there is lymphatic aggregation, and these lymphatic aggregation is called as lingual tonsil. We are concentrated today for the palatine tonsil. So palatine tonsil is residing in the tonsillar fossa. Between palatoglossal arch anteriorly and palatopharyngeal arch posteriorly, and palatopharyngeal arch posteriorly. Okay. Now, okay, before proceeding to the exactly histology of palatine tonsil, I would like to show you this Walder's ring. Okay, so this Walder's ring is actually, in case of we have got a ring because 4 lymphatic aggregation together, if we connect it, it is called as Walder's ring. So here it is formed by pharyngeal tonsil, tubal tonsils, palatine tonsil and lingual tonsil. So we already know the details of palatine tonsil. Palatine tonsil is residing in the tonsillar fossa, lingual tonsil on the posterior part of the tongue, pharyngeal tonsil and tubal tonsil. My dear aspirants, tubal tonsil means lymphatic aggregation. Tubal tonsil means lymphatic aggregation around the opening of auditory tube. What is AT means auditory tube. The other name of auditory tube is Eustachian tube. The other name is the Eustachian tube, which is also called as auditory tube. So just at this opening there is aggregation of lymphatic aggregation, which is called as the tubal tonsil. What about pharyngeal tonsil? So pharyngeal tonsil is formed in close aggregation or posterior aspect or posterior wall of nasopharynx. This nasopharynx will contains the aggregation of lymphatics, which is called as pharyngeal tonsil, and this whole is connected, which is called as Walder's ring, which will prevent the entry of foreign structures or any kind of pathogens entering into the interior of your oropharynx or nasopharynx. So this is important for the immunity. Now let's talk about the histology of tonsils. The basic points, so let me tell you about the, before showing you the slide, I would like to tell you what is the histological features of the slide, and then we'll proceed with the histological slide. Histology of tonsil. Histology of tonsil. First point, lining epithelium. So the lining epithelium in case of tonsil is stratified squamous non-keratinized epithelium. Non-keratinized epithelium. Stratified squamous non-keratinized epithelium. It also have lymphatic aggregation. It will also have lymphatic aggregation. Many smaller lymphatic aggregation is there. Tonsillar crypt. On the medial aspect there is a deep trench which is called as tonsillar crypts. So a slide which is on outer aspect, on the lateral aspect or on the superficial aspect, it is having fibrous capsule. But on the medial aspect it will have a deep tonsillar crypt on the medial aspect. So these are the features. So whenever you see a slide which is having many lymphatic aggregation, whenever you see a slide which is having many lymphatic aggregation, lining epithelium as stratified squamous non-keratinized epithelium, lymphatic aggregation with germinal center, tonsillar crepes in the medial aspect and lateral superficial part which is covered by fibrous capsules. All these features will suggest that this is a slide of tonsil. Very easy to identify. Tonsillar slide is very easy to identify. Okay, my dear aspirants, let me show you the slide now. So this is a slide of tonsil. The epithelium, as you can see, is multiple layer. Okay, see here. This whole is the epithelium, and very nicely you can appreciate this is multiple layered. So this is stratified squamous non-keratinized epithelium. Squamous non-keratinized epithelium. Lymphatic nodule. Lymphatic nodule, lymphatic nodule, lymphatic, so many lymphatic nodules. So these are what? Lymphatic nodules are there. Lighter stained GC. What is it? GC, germinal center. And also a very nice deep trench which you are seeing, this is the tonsillar crypt. This is what? Tonsillar crypt. So these are the features for identification of the tonsil slide. Now let me show you another few slides. So yes, this is a slide of tonsil. How you are going to identify? You can see the crypt. You can see the tonsillar crypt. So this is the tonsillar cleft which is seen. Okay, you can also appreciate what? You can also appreciate stratified squamous epithelium. Stratified squamous epithelium. You can see the germinal center is lying here. This is the germinal center, and this hole is the lymphatic nodule. This hole will be the lymphatic nodule. And this is multiple layered epithelium, that is stratified squamous non-keratinized epithelium. So this becomes a slide of tonsil. Few more. Palatine tonsil. See here, this is again a slide for the palatine tonsil. So exactly under the microscope, histological features. Lymphatic aggregations. See here, this is lymphatic aggregation. These are all lymphatic aggregations. Yeah, these are all lymphatic aggregations with a lighter stained germinal center. This is GC, lighter stained germinal center is there. Okay. So, okay, we have done with all the slides, and before starting few MCQs which I will explain you, and so that you can understand which type of MCQs are asked from this topic. But before that, all the 4 slide histological features and identifying features I want to brief, and then we will go on with the explanation of MCQs related to it. So, starting with the first one, that is lymph node. So, starting with the first one, that is lymph node. So, see here, when I am talking, so let me slightly highlight this diagram. Okay. So, is it okay? The entire slide is visible to you? Yeah. So, lymph node histological slide, the important feature which has been shown here is subcapsular sinus. Important features here, you can see the outermost covering is the fibrous capsule which you can see. Okay, fibrous capsule is there. The second point which is marked as subcapsular sinus. Lymphatic nodules. These are all lymphatic nodules which is residing in the cortical area. The center is GC, germinal center, and medulla is there. Now, what are the identifying features? It will have thin capsule. It will have a very thin capsule. It will have a subcapsular sinus, a gap or a space residing below the thin capsule is subcapsular sinus. It will have a lymphatic aggregation just below the subcapsular sinus, and the medulla is composed of medullary cords and sinuses. The medulla is composed of medullary cords and sinuses. So, this is the important black boxes which I have included, so that the evident features of the lymph node, the evident features of the spleen, the tonsil, and that of the thymus can be visualized. So, it is important that you should go through this identifying points, because this will give you the correct point for identification of histological slide if it comes for a image based MCQ. That is very important. So, do concentrate on these histological features. Okay, so then we will move on with the spleen. Next slide is spleen. Now, when I am talking about the spleen slide, the important features which has to be shown to you is that it is consist of red pulp and the white pulp. So, you can see in the small box it is red pulp and white pulp has been shown, and here this is lymphatic aggregation, this is also lymphatic aggregation. So, what is the second number point? The second number point which you are seeing, this one and this one, what is this? This is the central arteriole. So, central artery you can see is eccentric in position, and the identifying features, if summarized together, the most important identifying features if we correlate together, a spleen slide is consist of white pulp, red pulp. White pulp contains lymphatic aggregations with germinal center. Red pulp contains the splenic cords and that of splenic sinusoids. Okay, so thick capsule with trabeculae dividing the white pulp and the red pulp is there. The lymphatic aggregation is there, which is traversed by a trabecular artery. Initially this trabecular artery is mentioned as central artery. Thereafter this is pushed towards the periphery, and the location of central artery changes to eccentric position. The red pulp of the spleen, which is when freshly dissected out or cut, it is red pinkish in appearance, and it contains splenic cords and splenic sinusoids. What is splenic cords? Splenic cords of Billroth is there, and we have already talked about all these points in the detail. This is just summary of the important identifying features so that you can identify the slide very nicely. Got it, everyone? So, you have to know in the spleen slide what is pulse. These all points are basically very, very important for you to know. Now, let's move on to the next, that is the slide of thymus gland. Thymus gland slide. Now, thymus gland, a primary lymphatic structure, lymphoid structure, and the thymus gland, as you know, it is also having an outermost fibrous capsule, but the most important feature for identification is that it will have a fibrous capsule. Along with it, it will have cortex and medulla. When you will see the interior of the medulla, there is hazel corpulses. So, this is the thymus gland, as you can see here. Okay, thymus gland is there. So, this is darker stained, this will be the cortex part. The lighter stained is the medulla, and here I will use this, what is this fourth number point? This is hazel corpulses. So, the most important feature is hazel corpulses residing in the medulla part of the thymus gland, which we have already talked. So, cortex, medulla, capsule, hazel corpuscle and blood vessels. Many lobules of lymphatic tissues has been shown. Darkly stained lymphatic aggregation in the cortex. Medulla is lighter stained, and in the medulla the characteristic point is hazel corpuscles. The characteristic point is hazel corpuscles, which is residing in the medulla. The number of hazel corpuscles increases with the age. The number of hazel corpuscles is increasing with the age. So, all these points, and only T lymphocyte will be present in the thymus gland. The other important point which you should not miss out is what is epithelio-reticular cells. In case of all lymphoid organs, reticular fibers are supporting network. In case of thymus, it is epithelio-reticular cells, and the epithelio-reticular cells is also contributing in formation of blood thymic barrier. So, done with this, let's move on to the important features of the last important slide, that is the palatine tonsil. Okay, so let's talk about the palatine tonsil. Okay, let me just highlight this. So, palatine tonsil important features, first thing and very important feature is that the lining epithelium, which is multi-layered, as you can see here. This is the lining epithelium which is multi-layered. And what is its type? It's the stratified squamous non-keratinized epithelium. It's of stratified squamous non-keratinized epithelium. Then you can see so many of lymphatic nodules. So, many lymphatic aggregations are there, which is having a, this 3 is the point of lymphatic nodule, and this lighter stained is GC, and this whole is the lighter stained is GC, and this whole is the lymphatic nodule. Lymphatic nodule with the lighter stained germinal center, and very nicely you can see here, this is the tonsillar crypt. What is it? This is the tonsillar crypt. So, this will be the tonsillar crypt. Okay. So, capsule, tonsillar crypt, lymphatic nodule, lamina propria, few mucous gland. Crypts are lined by which type of epithelium? Stratified squamous non-keratinized epithelium. Subepithelial lymphatic nodules, mucous glands are there. So for identifying the slide, if we see an epithelium which is stratified squamous non-keratinized epithelium, along with it we see number of lymphatic follicles lying or residing, and a tonsillar crypt is there. All these points will give you the characteristic feature points, and we can go in identification that this is a slide of palatine tonsil. So my dear aspirants, done with this. Now let's move on to the next. So we have done with this topic, but I would like to share few MCQs with you, how the MCQs are traced from the histological point and this histological slides of the lymphatic structures and general histology. So few MCQs just to make you know how the MCQs is made and how you are going to target it. So let's start with this MCQ session. Okay, so let's start with the first MCQ session. So I will provide you with 15 to 30 seconds to mark the correct answer, and then I will proceed to the next MCQ. So this is how we are going to target today's session. So see here, dense irregular connective tissue is found in, whether it is dermis, whether it is lamina propria, whether it is tendon or ligament. So you have to mark the correct answer, and your time begins now. Dense irregular connective tissue is found in which one of the following? Which is the correct answer, whether it is A, B, C or D? So yes, I will provide you with 15 seconds or to 30 seconds maximum, and then I will come up with the explanation. The correct answer here is, my dear aspirants, the correct answer is dense irregular connective tissue, dermis is the correct answer. Okay, so we have got 4 options, and let me rule out the incorrect options also. So dense irregular connective tissue means the connective tissue or collagen fibers are arranged in a very irregular pattern. So we know that dermis layer is the part of the skin, this is lying below the epidermis, deeper part, and here the irregular connective tissues are residing. Dense connective tissue is there, but the arrangement is irregular. So why not lamina propria is the right answer? Because lamina propria is basically containing loose connective tissue. It is not containing dense, but it is connecting loose connective tissue. Now also tendons and ligaments is not the correct answer, and the reason why tendons and ligaments are not the correct answer is that it is containing dense connective tissue, but the arrangement of this connective tissue is regular. It is connecting dense connective tissue, but the arrangement is regular. Also, aponeurosis is an example of dense connective tissue, and the arrangement of this structure is regular. So we have got A as the correct answer. Deeper part of the skin below epidermis lies the dermis, which is having irregular connective tissue arrangement. Let's move on to the next, that is question number 2. Stave cells are seen in liver, option A, spleen, option B, pancreas, option C, and gallbladder, option D. Just now we have discussed, so I will give you 15 seconds to mark the correct answer. Stave cells are seen in liver, spleen, pancreas or gallbladder. Stave cells are seen in, 4 options are there, mark the correct answer. So just now we have talked about stave cells also, and my dear aspirant, the correct answer is spleen. Okay, in case of spleen, when we are talking about the part of the red pulp, there is splenic venous sinusoids. Okay, there is splenic venous sinusoids. So there is splenic sinusoids, and these splenic sinusoids are spindle shaped. And this spindle shaped is surrounded by, this spindle shaped structure is surrounded by reticular fibers. It is surrounded by reticular fibers, my dear aspirants, and this will give you, this reticular fibers are surrounding it, and this will give you an appearance of stave cells. Why? The whole of the appearance of these structure is barrel shaped structure. Actually the reticular fibers are surrounding the splenic sinusoids, and also contains macrophages, plasma cells, and it will phagocytize the old worn out RBCs and erythrocytes. Actually this stave cells is the characteristic feature which is found in the red pulp of the spleen. So we have got B as the correct answer for question number 2. So done with this, my dear aspirants, let's move on to the third MCQ. All the best, dear aspirants, all the best. Now, identify the organs shown in the histological slide. Okay, this is a slide, this is a epithelium MCQ. So, this is epithelium MCQ. Take your time. We have got 4 options: urinary bladder, gallbladder, bile duct. We have got 4 options: urinary bladder, gallbladder and bile duct and skin. Okay. So, the correct answer here is urinary bladder. So, question number 3, the correct answer is urinary bladder. So, my dear aspirants, how you are going? So, what you are seeing, I am highlighting it. So, this is the outermost layer which I am highlighting it, and this outermost layer is umbrella cell. This is umbrella cells. This is umbrella cells. So, this outermost structure which I am highlighting is the umbrella cells. So, umbrella cells is seen as the outer. Actually, urinary bladder or ureter is having urothelium, that is transitional type of epithelium which is having the stretchability. This is a relaxed condition. You can see multiple layered, so approximately 5 to 6 layered epithelium stretchability is there, and the basal one is these are the basal cells which is columnar type. The outermost superficial type is umbrella outpoaching, and the middle one is polyhedral cells. So, all these features, so we can clearly see the epithelium which is giving us the target that this is the urinary bladder. Skin can't be the answer because it should have stratified squamous keratinized epithelium. Bile duct is also not, it will be having stratified epithelium. Gallbladder will have columnar epithelium with brush border microvilli. So, the correct answer which is having transitional epithelium. In this MCQ, the image which is provided to you is showing you a transitional type of epithelium which is in the relaxed position. So, this is a slide of urinary bladder, and this is the urinary bladder which is not stretched but is in a relaxed position, which is showing you this is a slide of the urinary bladder transitional epithelium or urothelium. A is perfectly correct answer for question number 3rd. So, yes, my dear aspirants, let's move on to the next. We have done with this. Let's move on to the next, that is question number 4th. So, this is question number 4th. Okay. So, yes, identify the histological slide. Identify the histological slide, whether it is spleen, whether it is lymph node, or whether it is thymus gland. So, you can identify the slide. Take your time, you will get 30 seconds for marking the correct answer. Take your take your time, and very nicely you can appreciate all the features which is required for targeting the correct answer. Identify the histological slide, whether it is a spleen, whether it is a lymph node, whether it is a ileum or thymus gland. So, yes, what's your answer? My dear aspirants, the correct answer is lymph node. So, B is perfectly correct answer. So, we have got lymph node as the correct answer. So, why it's the lymph node correct answer, I will tell you, because here all the features has been visualized. So, this is the fibrous capsule which you are seeing. This is the fibrous capsule. Just below the fibrous capsule, what you can visualize, this space is residing, and this was the characteristic feature which was seen in the slide of lymph node. This space is subcapsular sinus. This is subcapsular sinus. This is lymphatic aggregations. These are lymphatic aggregations which is having GC, germinal center, and lymphatic aggregations. So, slide having lymphatic aggregations which is having a germinal. So, this will become the cortex area, this will become the paracortex area, and which is having mainly paracortex area is having mainly T lymphocyte, and this is the innermost part which is the medulla part. So, yes, all these features will give us the correct identification of the slide, and very nicely we can appreciate that this is the slide of lymph node. This is the slide of lymph node. Spleen nahi hai, red pulp and white pulp is not seen. Ileum, not because GIT features has been not seen, all the 4 layers has not been seen, lining epithelium will be simple columnar. Thymus is not because Hazel corpulsus is missing. There is no Hazel corpulsus seen in this slide. So, we have got the correct answer B, lymph node. Okay, my dear aspirants, so let's move on to the next, that is question number 5th. Done? So, again this will be question number 5th. So, this is 5th number MCQ. So, take your time and identify the slide. Okay, so yours, just a minute. Yeah. Identify the histological slide, whether it is tonsil, whether it is ileum, whether it is duodenum, whether it is appendix. Identify the histological slide, whether it is tonsil, ileum, duodenum or appendix, my dear aspirants. A, B, C, D. Take your time, 30 seconds will be provided to you for marking the correct answer. My dear aspirant, the correct answer is tonsil. Why? Because lining epithelium, stratified squamous, non-keratinized epithelium of the crypt. Okay, what is this? What is this? What is this? What is this? This is the medial aspect of the tonsil, and what is this? This is tonsillar crypt. What is this? What is this? What is this? What is this? These are lymphatic aggregation. These are lymphatic aggregations. Lymphatic nodule, my dear aspirants. So, a slide which is showing all the features of lining epithelium, tonsillar crypt, lymphatic aggregation. So, this is the slide of tonsil, that is quite clear here. Now, why not this is a slide of ileum? Because ileum will have all the layers of GI and will have lining epithelium as simple columnar epithelium. Duodenum will also have simple columnar epithelium and also will have Brunner's gland in the submucosa layer, which is the identifying feature. So, no Brunner's gland. Appendix nahi hai. Why? Because appendix also will have a lumen and will have a lymphatic aggregation, but lining epithelium will still simple columnar epithelium. So, here the lining epithelium is multi-layered, stratified squamous, non-keratinized epithelium. Along with it, very nicely you can appreciate the tonsillar crypt on the medial aspect. So, definitely it becomes a slide of tonsil. Definitely it becomes a slide of tonsil. So, got it everyone? Let's move on to the next, that is question number 6. All the best for question number 6. All the best to you. So, let's move on to question number 6. This is question number 6. Identify the marked structure in the histological slide. So, can you see a arrow marked structure? Is a green color arrow is marked on a small structure. So, you have to tell me whether it is a central artery, whether it is ellipsoid, penicillar artery or none of the above. So, this is what you have to identify. Question number 6, you have got 4 options and you have to mark the correct answer. Whether it is central artery, whether it is ellipsoid, whether it is penicillar artery, whether it is none of the above. Question number 6, mark the correct answer. Okay, so yes, A, B, C and D. Which is the correct answer, dear? Which is the correct answer? Yeah. So, my dear aspirant, the correct answer is central artery. This is the slide of spleen. Okay, this is the slide of spleen and we have already talked about the spleen. In case of spleen slide, we have got white pulp, we have got red pulp, and in white pulp, we have got this location is of central artery. So, same slide, I will have an enlarged view. So, this is the fibrous capsule which you are seeing. This is the trabeculase which you are seeing. In the trabeculae, the trabecular artery traverses when it reaches the white pulp. So, this is all white pulp of the spleen. So this is the slide of spleen which we are discussing. So in the white pulp of the spleen, what you can see, this is the central artery, this is the central artery, and because of aggregation of lymphatic nodule, it is pushed towards the periphery. So this is eccentric position of central artery. This is eccentric position of central artery. Okay. Here the other areas which you are seeing, these are all red pulp, which is composed of the spleen, which is composed of splenic cords of Billroth, and it is consist of the splenic sinusoids. Okay. So very nicely you can see the lymphatic aggregation having central artery at the eccentric position, characteristic part and the characteristic point for the identification of the slide of spleen. This is the characteristic point for the identification of the slide of spleen. So which is quite evident here. Is it okay? So my dear aspirants, I would also like to show you the diagram of splenic cord of Billroth, where we have got splenic cord of Billroth sinusoids, and which is covered by reticular fibers, and this whole appearance of the splenic cord and the reticular fibers, this whole is called as stave cells, and stave cells are seen in the slide of spleen in the red pulp. So got it? So we have got the correct answer for question number 6A. Let's proceed to the next one, that is question number 7. Question number 7th. Okay. Identify the histological slide. So yes, again you will get 15 to 30 seconds to mark the correct answer. Identify the histological slide. Identify the histological slide. Okay, the correct answer is thymus gland. The correct answer is thymus gland. Why thymus gland is the correct answer? Because in this slide the most important feature for identification, that is Hazel corpulus, is quite evident in the medulla part of the gland. So thymus gland is the correct answer. So my dear aspirants, let's talk about the thymus gland. So let's talk about the thymus gland. Okay, let's talk about the thymus gland. Okay, so when we are talking about the thymus gland, you can see here, this is the thymic lobule, which is showing you the cortex and the medulla part. As you can see here, this is the cortex and the medulla part. Okay. Okay, so this is what? This is the cortex part and this is the medulla part. This is the cortex and this is the medulla part of the thymus gland. This is the lighter stained part, as you can see here. This is the lighter stained part of the medulla which you are seeing, which is containing the Hazel corpulus. What does it contains? It contains the characteristic feature for identity. So many Hazel corpuluses are there. So it is having many Hazel corpuluses. So all these points, which is epithelio-reticular cells, will be residing, and these are all important points for identification of thymus gland. Now coming to blood thymic barrier. Okay, so blood thymic barrier, what is the function of blood thymic barrier? It prevents the contact of high concentration of antigen circulating in the blood with that of immature T lymphocytes which is developing in the thymus cortex. The lining epithelium for blood thymic barrier is endothelium, basement membrane of endothelial, the connective tissues surrounding it, basement membrane of epithelio-reticular cells and epithelio-reticular cell itself. So the supporting network of the thymus gland, which is formed by epithelio-reticular cells, is contributing to the formation of blood thymic barrier, BTB barrier, which is very important. So got it everyone? Let's move on to the next, that is question number 8. Easy one. So yeah, this is a MCQ which is targeted from epithelium. A patient is presented with acute abdominal pain, and on clinical examination the patient underwent the cholecystectomy operation. So what will be the finding in the patient, whether the patient will have which type of epithelium? Squamous epithelium, simple columnar epithelium with brush border, cuboidal epithelium with stereocilia. So we have got 4 options for question number 8 and you have to mark the correct answer. Question number 8. Four options are there. Squamous epithelium, simple columnar epithelium with brush border, cuboidal epithelium with stereocilia. According to you, which is the correct answer? So my dear aspirants, it's an easy one only. You have to just see the structures. Cholecystectomy has been performed. That means gallbladder has been removed. So in case when the gallbladder is removed, we have to know it by epithelium. So we know that lining epithelium of gallbladder is simple columnar epithelium with irregular arrangement of microvilli. So the correct answer will be C, simple columnar epithelium with brush border. The correct answer will be C, simple columnar epithelium with brush border. Got it, everyone? Now this is the slide of gallbladder which has been shown to you. Here you can nicely appreciate the simple columnar epithelium has been shown. Microvilli is there, which is brush border. Why brush border? We know irregular arrangement is there. Columnar epithelium is also very nicely seen, columnar epithelium. The other important point for the slide of gallbladder, which is many times has been asked for MCQ, 2 layers which is absent in gallbladder. So there is absence of muscularis mucosa layer, and plus the submucosa layer. So submucosa layer and muscularis mucosa, these 2 layers are absent in the slide of gallbladder. There is muscular adventitia layer or the serosa or muscular externa layer, but there is no muscularis mucosa or submucosa layer in case of gallbladder slide. Got it? Let's move on to question number 9. Okay, question number 9. Hard palate contains, what is the hard palate epithelium? So whether it contains keratinized mucosa, whether it contains absent submucosal layer, whether it contains minor salivary gland. So you just read the 4 options which is provided: keratinized mucosa, no submucosal layer, or keratinized mucosa with submucosal layer, minor salivary gland, non-keratinized mucosa, absent submucosal layer, or having minor salivary gland. So actually 4 combination has been given and you have to mark the correct answer. Actually this is the lining epithelium of palate, and this was the MCQ which has been asked in the 2019. This was the MCQ which has been asked in 2019 NEET PG exam. So yes, your time starts now. Mark the correct answer. Okay, I will provide you with 15 seconds. Mark the correct answer. The correct answer is keratinized mucosa, submucosal layer, minor salivary gland. Keratinized mucosa, submucosal layer and minor salivary gland. This is the correct answer. So we got B as the correct answer. Okay, so here you can see this is the bone part, B for bone, this is submucosal layer, this is the lamina propria layer, and this is the epithelium. Epithelium is stratified squamous keratinized epithelium, Okay, so this is the whole histological part of hard palate which you have to know. This is whole details of the hard palate which you have to know. Okay, so this is whole detail. Okay, so we have done with this. So we have got B as the correct answer. So this is the reason B is the correct answer. So before one more MCQ is important, that is epithelium lining of the lingual part of epiglottis. So you will get just 15 seconds to mark whether it is simple columnar, pseudo stratified ciliated columnar, simple cuboidal, stratified squamous epithelium. Okay, my dear aspirants, so you have to mark this as a correct answer, and your correct answer is epithelium of lingual surface. The correct answer is lingual aspect means close to the oral aspect. This is stratified squamous epithelium. So D is absolutely correct. Pseudo stratified ciliated columnar epithelium is the Again the epiglottis lining, but it is towards the respiratory aspect, respiratory epithelium की तरह होता है. So two epithelium, but here the lingual part means close to the lingual aspect, tongue and the oral cavity. So close to the oral cavity the lining epithelium will be stratified squamous epithelium. Close to the respiratory aspect it will be pseudo stratified ciliated columnar epithelium. Okay, so before ending the session I just want you to tell that if you are going to take 2 years of subscription, you are getting 4 months of subscription absolutely free. For 1 year, you are getting 2 months of subscription free. For 6 months, you are getting 1 month of subscription free. So if you are interested for taking the subscription, you can use my code ANAT10 and get 10% discount. So additional discount of 10%. So just go for it and grab this opportunity. This is highly important. And if you are planning, you can take this subscription, and also you can join me for the special class on the Unacademy app. You have to download and you can be present for the special free session. You can use the code ANAT10 to, if you are using the platform for the first time, and you can be present for live session. So you will get the updates and link of all my session in Let's Crack NEET PG Telegram group in Unacademy INICT NEET PG Telegram group. So do like, subscribe and download. You can also download the PDF notes in the Unacademy app. That is highly beneficial for you. All the best. Keep studying. Thank you so much. So again we will meet with the upcoming session. Thank you aspirants. Thank you.